Let's forget about packing and shipping and getting your stuff and unpacking and throwing in the boxes. We all know all that. Not that much fun. The new edition of Maximize Your Medicare is already available in ebook format. The paperback edition is coming out within a month. Medicare is complicated. There are penalties. There's new terminology. All of that is addressed. Most importantly, the fact is that you need a consolidated strategy. There are important nuances all throughout the book. Any single one of them can totally change your configuration or what's best fitting for your situation. There's lots of information in the world. There are tons of commercials. You get lots of mail. There are videos on here on YouTube. The fact of the matter is, I don't love that approach because of the fact that something can get missed. The official website to the book is www.maximizeyourmedicare.com. Be sure to subscribe to this channel to stay up to date. The Medicare system is going to change. It evolves. It has evolved over the 10 years that I've written Maximize Your Medicare. Welcome to the channel. Anyway, here's some very important things you need to keep in mind when you actually move. For example, you've got to take care of homeowners insurance, auto insurance. Your addresses have to be changed. For most places, that's going to be okay, especially if you use a large national carrier. However, you need to understand that local carriers, state-based carriers, can provide better pricing. Don't presume that the carrier who is best in your old location is the most efficient in the new location. I wouldn't conclude that at all, because the carriers are choosing individually, intentionally, to be competitive in one spot versus another. There are going to be special sections of the podcast here where I'm going to be inserting extra comments because, just didn't have time, and YouTube is basically driving people to shorter videos. But the reality is sometimes we need some extra comments. And so what I'm going to do is I'm going to break in sometimes and add stuff. Here's one. This is crazy. Even the big national carriers, what ends up happening is that the agencies, et cetera, in your local city, town, strip mall, whatever it would be, they literally sit in fear that their parent company will re-rate, the entirety. Let's just call it auto. And then what ends up happening is that corporate says, okay, here's our new rate. And in doing so, what they're basically doing is putting their agents at risk and hoping that you don't look around. Literally, that's what they're trying to do. And InsurTech is actually a new thing, if you will, meaning that you are having this convergence of InsurTech, FinTech. You're seeing technologies where you can buy online, et cetera, et cetera. This is going to be very disruptive over time. I don't think that's going away. The asset managers, the wealth managers, they understand, I believe, after a considerable amount of time, the fact that they've overlooked other aspects of financial planning, like Obamacare, like the taxes of Medicare, et cetera, et cetera. It doesn't matter where you're trying to relocate. That's the case all the time. It's not only statistics, but it's in addition to that, insurance carriers are intentionally choosing specific geographic locations for their own reasons. You and I are never going to get that insight. They're never going to tell us that, but that's the case. When it comes to health insurance, here's what you need to know. If you have Affordable Care Act insurance, let's say you bought it on healthcare.gov, let's say you bought it on your state marketplace, you have the right to change plans. What you cannot do is you cannot simply enroll in health insurance if you did not have health insurance prior to the time that you moved. The new carrier is going to ask for evidence to prove that you had health insurance in the past. For those persons on Medicare, also another set of things you need to consider. For those on Part D or Medicare Advantage, you may need to switch plans. Here again, very subtle. So what ends up happening is even if you move from, let's just call it, you move across state line and you've got a Medicare Advantage plan, and let's just call it Medicare Advantage Plan X. Even if that plan under the same name exists in the new state, you still need to re-enroll. Even when the plan has the same name, you can have different copay, deductible, out-of-pocket maximum from state to state. When it comes to Part D, you still need to re-enroll. And again, even if the plan has the same name from the same carrier, that doesn't mean that all of the copays are the same. It almost certainly means that the preferred pharmacies are going to be different, meaning that local pharmacy number 235 is just not going to be the same as your old location. There are times when you don't have to change, and here's the addition to the video. If you're staying in the same location, meaning the same state, it is generally the case you don't have to change Part D plans, because the way that Part D generally works is that the entire state is covered by a particular plan. Therefore, you don't need to change. The same cannot be said for Medicare Advantage. You need to switch plans. You do have time here, but please remember, for especially if you have a Medicare Advantage HMO, the hospital, the doctors must be in network for that plan. And so now you've moved to your new location. If they're not in network, you're responsible for 100% of the costs under HMO. Under PPO, slightly different. You can use your PPO in location 2. However, you would be charged the out-of-network cost if your doctor, hospital, clinic wasn't in network. In addition to that, you can presume that the out-of-pocket maximum and deductible can be different. This is the case anytime you use a combination of in-network and out-of-network providers. For persons who are Medigap policy owners, now actually a bit more subtle. You can continue to have your Medigap plan in your new location. That is indisputable. However, what you need to know is that the pricing, kind of like what I said under the auto insurance example, I can tell you that the prices will wildly vary from state to state, from carrier to carrier. Let's say you were with Carrier 1 and you moved from Illinois to Iowa. I'm just making it up just for illustration's sake. Carrier 1 may have been the most competitive in Illinois. That doesn't mean that it's the most competitive in Iowa. In fact, they may not even be involved in Iowa at all, in which case you could be assigned a much higher Medigap premium, dramatically higher. $1,000 a year, very possible. There can be exceptions. For example, if you move to a state with special Medigap enrollment rights, which are above and beyond the federal Medigap policies, then it may be possible that you are able to switch into a more efficient, cheaper Medigap carrier and keep the same plan. My clients, we've had this discussion in advance, because the reality is, in my example, when we moved from Illinois to Iowa, maybe what we've done is found the carrier which is competitive in both locations, meaning that they knew they were going from Illinois to Iowa. And maybe carrier number 3 wasn't the most competitive. Maybe it wasn't the absolute cheapest in Illinois, but in Iowa, they were. Okay, maybe then we needed to choose carrier number 3 right from the beginning. This is a subtle point on Medigap which can cost you or save you thousands a year. In fact, it's so dramatic that certain persons may even choose to live in a different state. Let's just say, for example, you were going to live in your RV and you were going to make a particular state your home base for a year, and then choose another state later. So while my example is extreme, the fact of the matter is, could you then cherry pick the states to the place where Medigap is more affordable, thereby saving you the money? Or move to a state where you had these special rights to get access into Medigap? Possible. That is possible. And again, like I said, the difference in premium, thousands of dollars. One very important point, and you can see it in this interview that I had with Kim Browning, who is an elder law attorney. You need to know that if you have a will or trust, that this is governed by the state. And the state, all of the rules, for example, the complicated matters of guardianship that Kim and I spoke to for an hour, the rules, the laws change from state to state. As a result, you want to make sure your legal documents that govern you and your family, your belongings, are kept up to date.
Financial matters are kind of like a jigsaw puzzle. No matter what stage of life, whether you're a millennial, whether you're Gen X, whether you're in retirement. Jay's Corner is the name of the YouTube channel, as well as the name of the newsletter. You know, I know it's natural that people shake their head and say, well, you know, it shouldn't be this way, or I don't understand why it has to be so complicated. I'm just going to tell you that that's a different channel. That's a different topic. That's a different discussion entirely. I'm not out here trying to cast judgment on your individual jigsaw puzzle, how the pieces fit or don't. What I do know is the amount of noise that you're hit with is incredible. This is the world that we have. Let's try to do the best with the rules as given. Jay's Corner is here to help.